if you guys happen to see anything that needs to be updated. So for example, on the appointment scheduling, we need to fix that. And then if you happen to see, I gave you a highlighter and a pen if you wanted to write on this at all, if you have any thoughts. If you see anything that needs to be modified. And then, of course, Newman, you're going to have to read this stuff over.
Yes, I read it over and
Okay.
anything needs to be changed.
So maybe tomorrow we can get together. I don't have any patients tomorrow, so maybe tomorrow we can get together and make any of these changes.
After Dr. Robinson's office.
Yes, okay, yeah. We've looked over the comment card. But the main page that I want to get to here is the fee schedule, okay? And that, right now, this is our fee schedule right now. This is probably about the 5th or 6th draft of this. We've consulted with 2 or 3 host offices, and our overall general philosophy is, keep it simple, stupid, and try to get away from as much a la carte billing, So, because, the patient basically, the ideal situation for the patient is, hey, look, you need to have this procedure, this is how much it costs, and that's how much it ends up being, okay? Your insurance will pay X number of dollars, you're going to pay this amount of dollars, and there's not a whole lot of, well, if the doctor gets in there and has to do this, that, and the other thing, and I quite frankly think if we can make the process more efficient, easier for the front desk team, that's going to be our competitive advantage over the periodontist that just says, hey, I'm going to try this traveling thing on my own, okay? In fact, I know for sure that, Dr. Campbell has a very nice periodontist in his office. He likes him, he does good work, but the problem is the billing and the scheduling. It's a nightmare, okay? And so that's where we need to be better, okay? And I think we can. So, what we're basically telling doctors is, hey, look, we want the option to have our VIPS periodontist to be better than the other options, okay? Better meaning easier to schedule. If the make the financial arrangements. The actual fees, let's make them simple and competitive, okay? Meaning that the patient feels like they're getting it done for at or less than they could be having it done if they went to a regular periodontist, okay? And that's our sort of market entry philosophy, because we need to work out some of the kinks of this and make sure that we get enough and quick enough market penetration. So, for example, the first fee is a straightforward, and if you look at this fee schedule right now, we've put the codes, what description we're using for it, what diagnostic data we need from the general dentist, okay, and approximately how much time to schedule it for, okay? So, your basic straightforward dental implant, number 19, has been extracted for 100 years. They send you a PA, everything looks good. So Newman's going to offer that for anywhere from $2,000 to $2,500, okay? And Newman's been traveling with me for probably the last month. And what I've noticed when I put in implants, he likes to put in bone grafts on the buccal when I wouldn't, And so and that's stuff that sometimes doesn't come up until you actually lay the flap, okay? And so our philosophy is going to be, if the patient's been told it's $2,000, it's going to be $2,000. And you have to do a bone graft and a membrane, it's still $2,000, okay? The next one, and feel free to jump in if anybody wants to, but the whole purpose of this is so that we're all on the same team and we're speaking the same language when we're talking to offices and stuff like that. And so, but if anybody has any questions or whatever, feel free. All right. Now the second situation is when the patient has a tooth in place, okay, and they send, number whatever it is, and they say, hey, this patient wants to have their tooth pulled and wants an implant, okay? Our philosophy on that's going to be, tell the patient one fee for the extraction, the graft, the membrane, everything, okay? And also tell them, in about, let's say, whatever, take a guess, in about 50 to 60% of these cases, we can do it in one appointment, okay? However, sometimes it takes 2 appointments, okay? The fee's not going to change, okay, whether it's 1 appointment or 2 appointments, okay? That's basically the philosophy there,
Sedation's not included in this fee?
Correct.
Okay.
Yeah, and right now, he's not doing sedation.
Okay.
So, we're working on that. He's got his sedation credential, but he hasn't got his permit yet, doesn't have his DEA license yet, and certainly doesn't have his portability permit yet, okay? And so, right now, in the last 4 months, we've been primarily focusing in on, the relationship side of things, and we haven't spent a whole lot of time on, efficiencies with extractions, or certainly not with IV sedation yet. He started a few IVs, but we've got, bigger fish to fry right now, One of the thoughts that I had was, if there is a case that does need sedation, one of us can go sedate the patient, either Dr. Williams or Dr. DeSimone, or myself, or Brian. Okay, and again, feel free to jump in. The next case is going to be a dental implant with an internal sinus lift. Okay, that's going to be like number 3, where there's 4 or 5 millimeters of bone. Okay, those are pretty standard situations. Okay, but it's the same thing. It's one fee. I don't think, probably not going to turn those into 2 appointment cases, but. And then there's going to be the lateral sinus lift, okay, where it's number 2 or 3 and there's no bone, and that's all he does is come in and do a sinus lift. Okay, now we had a meeting, Elaine and I and Newman had a meeting about what goes on at the periodontist office, because I think you all know Elaine works full-time with a periodontist. She's also has, I think, over 10 years of experience working in an oral surgery office in a multi-doctor setting. So, the codes generally are, I guess, 1 tooth and then 2 and 3 teeth. Is that right?
1 to 3, yeah.
Yeah.
You use the same code.
Okay. So basically, what we're doing is, if a patient needs osseous surgery, and it's 1 to 3 teeth, then it's going to be this fee. Okay? If it's more than 4 teeth, then it's going to be the next fee. Okay? And we've done basically the same thing with connective tissue grafts. Okay? And from what I understand, connective tissue grafts are basically the wisdom teeth of perio. Okay? In terms of ease and profitability, and if you've got a good restorative doctor that, really pays attention to this stuff, it's like rampant. I mean, it's everywhere in their office. There's
It's easy to treatment plan too because it's aesthetic. They see the aesthetic right away.
The patient does.
The patient does.
Yeah.
With the CTGs and the gingivectomies too. I mean, the patients are so thrilled. So that's definitely one that we're going to definitely need to use before and after photos, because that's something patients can see right away.
And that's one of the things that we talked about, that he's going to have a little, maybe a little PowerPoint presentation on his iPad or something that I bought for you yesterday. And anyway, so the connective tissue graft situation, again, what we're going for is simplicity. When Elaine presented us with, the periodontist and also Dr. Islerson's fee schedule, it was like 4 pages. Okay, and when they go to the periodontist, they have time for what if we do this, and if we do this, and we'll let you know when it's over, blah 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 blah. So this is our simplicity straightforwardness, okay?